I'm Dr. John Sweetenham, the host of the ASCO Daily News Podcast, with my top takeaways on selected abstracts from Day 2 of the 2024 ASCO Annual Meeting. Today's selection features potentially practice-changing results for patients with advanced stage Hodgkin lymphoma, results from a large trial testing the effect of metformin in patients on active surveillance for their prostate cancer, and early results giving insights into the benefits that artificial intelligence may bring to address disparities in cancer care. My full disclosures are available in the transcript of this episode. The first of today's abstracts is LBA 7000, which reports the results from a large international randomized trial in patients with advanced Hodgkin lymphoma, presented by Dr. Peter Borkmann from the German Hodgkin Study Group. Since Hodgkin lymphoma typically affects adults in their 20s and 30s, the focus of clinical trials in recent years has been on achieving high rates of disease control, while at the same time reducing the potential for short-term and long-term toxicities associated with classical chemotherapy and radiation therapy regimens. Particular emphasis has been given to reducing risk for secondary malignancy and impaired reproductive function in long-term survivors. Building on the back of previous studies from this group, the escalated BIACOP regimen was modified to reduce the overall duration of treatment and the potential for toxicity by incorporating novel agents, including brentuximab vedotin. This novel regimen, known as BRICAD, was compared with escalated BIACOP in a randomized trial, HD21. Patients received 4 or 6 cycles of therapy based on the response of their disease to the first 2 cycles, assessed by interim PET scan. 1,482 patients were randomized, 740 to escalated BIACOP and 742 to BRICAD. With median follow-up at 48 months, the 4-year progression-free survival was 94.3% with BRICAD, compared with 90.9% for escalated BIACOP, with a hazard ratio of 0.66. These results are particularly noteworthy since 64% of patients on the BRICAD arm had a negative PET scan after 2 cycles of therapy and therefore received a total of just 4 cycles, reducing their risk of toxicity. On that note, lower rates of treatment-related toxicity were observed with BRICAD. Specifically, hematologic toxicity and peripheral sensory neuropathy were less frequently seen. Female reproductive toxicity was lower with BRICAD, with more than 95% of women having normal FSH levels after 1 year on BRICAD, compared with 73% on escalated BIACOP. Dr. Borkmann also noted that recovery of male reproductive function was improved with BRICAD, although details were not provided. These are impressive data. Although no overall survival difference was observed, this is not surprising in view of the effective salvage therapies available to patients whose disease relapses after first-line therapy. The authors conclude that these results are unprecedented for the first-line treatment of Hodgkin lymphoma, and that the BRICAD regimen should be considered as a new standard of care option. Although these results are likely to change practice in some parts of the world, particularly in Europe, it's less clear whether they will impact current treatments in the United States, where modifications to the ABVD regimen, including the addition of brentuximab vedotin and more recently nivolumab, have been the subject of recent randomized trials. That said, these data add to the increasing evidence that cure of advanced Hodgkin lymphoma is possible in most patients, and that concerns over short and long-term toxicities of therapy for this young group of patients are being addressed using several strategies. The next abstract, late-breaking abstract 5002, reports the results of a Canadian study investigating the use of metformin to slow or prevent progression in patients with low-risk prostate cancer on active surveillance. Professor Anthony Joshua pointed out in his presentation that there are extensive epidemiologic, biologic, and clinical data suggesting that metformin may affect the progression of low-risk prostate cancer. But this has not previously been evaluated in the context of a randomized controlled trial. The MAST study for metformin active surveillance trial was designed to prospectively evaluate the use of metformin in patients with low-risk prostate cancer eligible for active surveillance. Patients were eligible for the trial if they had been diagnosed within the previous 12 months, had low-risk prostate cancer defined as a Gleason score of less than 6 in less than one-third of cores involved, and less than 50% of any one core, plus having a PSA of less than 10. These patients were randomized to either active surveillance plus placebo or active surveillance plus metformin at an initial dose of 850 milligrams daily for 1 month, followed by 850 milligrams twice daily for 35 months. Evaluations, including prostate biopsies, were performed at baseline, then at 18 and 36 months. 405 patients were randomized 1-to-1 and were well matched for patient characteristics and risk factors. Pathologic and therapeutic progression were the major endpoints of the study. The overall results of the study showed that the use of metformin in this population had no effect on pathologic or treatment progression. Although not a planned analysis, there was a signal that the use of metformin may accelerate progression in certain patients, including those with a high BMI. This study shows definitively that metformin should not be used in low-risk, localized prostate cancer patients who are eligible for active surveillance. There are many unanswered questions about its use in other situations in prostate cancer and in low-risk patients who also have diabetes. The final selection for today is Abstract 100. In this presentation, Dr. Alison Modell from Montefiore Einstein Comprehensive Cancer Center in New York City described an artificial intelligence platform which showed potential to improve patient outreach and adherence to medical appointments. In underserved communities of color, barriers to colorectal cancer screening can contribute to disparities due to late-stage diagnosis and poor outcomes. Despite active outreach by skilled patient navigators at this center, which serves an ethnically minoritized and disadvantaged population, 59% of patients either canceled or did not show for their colonoscopy appointments in 2022. While patient navigator re-engagement efforts led to 21% eventually completing colonoscopy, 1,500 patients did not undergo potentially life-saving colon cancer screening that year. The study used MyEleanor, a virtual patient navigator that engages in personalized AI conversation to target 2,400 patients who had not attended their colonoscopy appointment in 2022 to 2023. MyEleanor called patients to discuss rescheduling, assessed barriers to uptake, offered live transfers to clinical staff to reschedule, and provided procedure preparation reminder calls. During the study, 57% of patients engaged with MyEleanor, with 58% of this group, or 33% overall, accepting the live transfer. The rate of completed colonoscopies for patients who did not show for their initial appointment nearly doubled, from 10% to 19% after the initiation of MyEleanor. Overall patient volume increased by 36%. Nearly one-third of the patients reported at least 2 barriers to screening. Top barriers included lack of perceived need, time, medical mistrust, concerns about findings, and cost. The investigators plan to extend these studies to explore the impact of this tool on patient preparation adherence, staff burden, and revenue. As data emerge on the potential applications of AI in the cancer care ecosystem, it's exciting to see how tools such as this have the potential to improve rates of prevention and early detection and address cancer care disparities. Join me again tomorrow to hear more top takeaways from ASCO24. If you value the insights that you hear on the ASCO Daily News Podcast, please remember to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.